Well, a lot of us are dealing with allergy issues from that pollen out there right now, but if those symptoms just keep on dragging out no matter what you do, it could be something a little bit more serious. Dr. Patrick Owens is here right now to discuss a little thing called sinusitis. That sounds like a huge word. It sounds scary, but explain to everyone out there what sinusitis is.
Yeah, sinusitis is simply just an inflammation of the sinus cavities, usually associated with facial pain, pressure, amongst some other things. Some people get fevers, that kind of thing, but really it's just inflammation of the sinuses.
Now, is this a bacterial thing, a viral thing, or could it be both?
It oftentimes starts viral, and then it progresses to bacterial, but other things can cause it. Autoimmune disease can cause it, allergies can cause sinusitis, and it's just when it gets bad enough to cause the inflammation and pain and pressure in your face.
Now, we've all been seeing our cars are covered in pollen right now. You see pollen all over all surfaces, so obviously you know pollen count's really high right now. How do you know that you're not just dealing with the effects of pollen and it's not something more serious like sinusitis or maybe even the flu? How can you tell the difference?
Yeah, so oftentimes allergies or allergic rhinitis, you get this runny nose, sneezing, itchy, watery eyes, and those kinds of things are very classically allergies. Sometimes people get itching on their skin, their asthma acts up. When those things are happening, allergy medications over the counter, nasal sprays, those things can help. But if it starts to get worse, facial pain, pressure, kind of nasty drainage, loss of smell or taste, then it's probably time to see someone about it.
And then what can you guys do? Because you mentioned over-the-counter medications and sinus sprays, nasal sprays, and what have you. I guess my question is, what more can you do in the office that you can't do with these over-the-counter medications?
Well, things you can do is you can do scope exams, CT scans to evaluate to make sure there's not worsening disease, and then allergy testing. Skin testing or blood testing to kind of look, do we need to do some sort of immunotherapy? Oh, wow. Okay.
And so if people have more questions, obviously, because we're at the height of what seems like the never-ending pollen storms out there. How can they get more information from you guys about kind of differentiating between allergies, sinusitis, maybe even the flu, or if they just want to ask you guys more questions about this situation?
Oh, well, they come to our clinic. We're ENT Associates of Alabama, so you just come and see us. You can find us online at entalabama.com, and we'll be happy to set up an appointment and get an evaluation and figure out what's going on.
All right. Well, we appreciate your time, so thanks so much, Doctor.
Thank you.
I know that pollen out there is working on everybody right now.
It's heavy.
All right. Well, have a good one. We appreciate it.